single mother who just arrived from Uganda with her children, leaving her previous life behind in hopes for a better life in Canada. This is a prime example of an immigrant starting point in a new country with nothing.
Going to do. Please, stay right there.
Yeah.
Hi.
Yeah.
Hello.
Hold
Hi.
on.
Hi, ma'am.
Yes.
I'm new to Canada. Help me.
I don't understand what you're
Me,
saying.
new in Canada, new.
I don't
Help
understand
me.
what you're saying. Can you speak English, ma'am?
New. Please, help.
Immigrants.
Help. Yes.
Tired.
Hold on. Now what?
We have chosen to explore the issue of vulnerability of immigrants with a focus on the mental health challenges that they are at increased risk of
I'm a
facing
single
when coming
mother.
to a
I
new
have no support, very limited funds, nowhere to live, and I do not know where to access any resources. Later on, take care of my 2 kids in this new country.
one.
Can you imagine being this family in Canada? This is a community health issue because mental health not only affects the individuals, but it affects the whole family and the community financially and takes a toll on the community's overall well-being and resources. More specifically, the social determinants of health has major impact on the health of new immigrant communities. It's very important that nurses provide the necessary care, support, and resources for this vulnerable population, and more importantly, advocate for them to empower this population to live in a healthier and better life.
So nearly 60% of all newcomers to Canada are economic immigrants, 27% are sponsored by a family member living in Canada, and 13% are refugees or temporary workers. Immigrants have an increased risk of mental disorder compared to the general population. It is believed that the migratory or post-migration experience may play a role in the etiology. Research study done in Ontario suggests that there are higher rates of hospital admission for mental disorder or psychotic disorder in areas with a large portion of first-generation immigrants. Immigrants to Canada often show slightly lower rates of mental disorder than the general population. The 2000-2001 Canadian Community Health Survey found that newly arrived immigrants' length of residence between 1 to 4 years had the lowest rates of depression and alcohol dependence compared to the general Canadian population. However, their mental health tends to worsen over time to match the general population. Immigrants are less likely than their Canadian-born counterparts to seek out or be referred to mental health services, even when they experience comparable level of distress. This can reflect both structural and cultural barriers, including the lack of mobility or ability to take time away from work, language barrier, a desire to deal with problem alone, and the concern that problems will not be understood by the practitioner because of cultural differences and fear of stigmatization. In many developing countries, mental health services are associated only with custodial or hospital treatments of the severely ill patient. Mental disorders are highly stigmatized in most countries due to specific cultural explanation. Therefore, individuals tend to avoid symptoms of a mental disorder.
How is this issue related to social injustice and health inequity? I'll start by saying most of the immigrant families that come to the country come in search of safety, socioeconomic and educational improvement for themselves and their children. Unfortunately, cultural and legal issues may delay their progress, such as traumatic experience in crossing the border, lack of status, and so on. These people accumulate lots of stress due to isolation, family responsibilities, financial obligation, and basically most of the social determinants of health. All these situations have mental health impact, including increased rate of depression and anxiety. This proves to be a health inequity because it's something I believe the government could do something about. It could be avoided. And it is a problem of social injustice because there's not enough of resources and funds that exist for immigrants, and even if they are, it's not accessible to them. Because most immigrants are working like 3 jobs and they don't have the time to go access the primary health care after they work. Or their work don't even allow them to take off work to go do that because they can't get enough money to be able to feed the kids or their family. So imagine immigrants living in a social justice community. Those avoidable sickness such as mental health problems would not need to happen. People won't have the quality of life deteriorate due to low income, unemployment, housing, and social support.
Challenges faced by new immigrants in accessing healthcare in Canada. The complex array of federal and provincial territory healthcare eligibility and entitlement categories can be a serious barrier to care for newcomers to Canada. The eligibility rules and length of time that immigrants must wait for landed status and health care when they apply from within Canada vary significantly across the country. Changes to the federal interim health program in 2012 limited healthcare services eligibility further and have caused confusion for care providers and recently arrived families. There are large populations of uninsured newcomers to Canada, with a total estimate as high as 200,000. Patients who are ineligible for health care report higher levels of anxiety, stress, and advanced illness. Newcomers to Canada may have a negative attitude towards authority and be less trusting of political and social organizations if such groups are associated with harmful experiences in their home country. Immigrants or refugees may not seek care if they believe that their health or personal information will be used against them. Many children and youth have difficulties explaining their symptoms. Care providers must be especially careful when trying to clarify a child's symptoms by asking parents to explain them. This approach can make the child more reserved and result in misdiagnosis. Culture influences dominate views of the causes and management of illness. When care providers and patients are from different cultures, their respective understandings of illnesses or treatment may vary significantly.
The first stereotype is that people believe that immigrants are uneducated and have a low labor sense. Out of 700,000 illegal immigrants crossing into the US each year, it was found that most immigrants have a history of good education and most have skilled work experience. The second stereotype people have is that immigrants cause labor shortages and often do jobs that local people are not trained to do. Industries such as the food processing industry cannot survive locally without immigrant labor. Immigrants actually do not drive down wages. Instead, they help the labor market and economy grow. The third stereotype people have is that immigrants pressure on our school and health services. It is true that increased amounts of people put increased pressure on local services and extra resources are needed. For example, immigrants might need help with translation. But on the other hand, immigrants have helped to save some schools from closure and are actually a cultural and language resource. The fourth stereotype is that people believe that immigrants are loud and cause increases in crime rate. It is okay to accept the fact that poor relationships with local people are sometimes caused by the behavior of individual incomers. The negative stereotypes about national groups, that they are loud, they have loud parties, they're dangerous drivers, they're aggressive, they're violent, they're heavy drinkers, and that they're rude, may all be indeed actual behavior and incidents. When someone from another country misbehaves, it stands out, and we forget how many local people are convicted of crimes. Everyone is subject to the law and should behave. If an immigrant acts inappropriately or misbehaves in any way, that should not label other immigrants as bad or that they act inappropriately.
Many immigrants face unsuitable living conditions in their country of birth, like civil war, corrupt governments, poverty, oppression of women, violence, and the sex trade, amongst other things, which forces them to seek safety in another country. Some immigrate in hopes of finding more opportunities for themselves and their families, and others are simply joining their families who have already traveled overseas. However, the hardship does not end once they arrive to Canada. Many immigrants face strict government policies or racism and discrimination when trying to find a job, housing, education, and accessing resources. Yet they continue to be grateful for being allowed to live in a country with so many opportunities, and they continue to work to support themselves and their families, even if the jobs are low paying. Immigrants display immense resilience, unlike most Canadian-born individuals who would probably give up when faced with similar challenges. Immigrants have a lot of courage when they decide to pack up their entire life and plunge into the unknown. They are very strong as they cope with extreme deprivation and survive against adversity. Immigrants generally have strong work ethic and aspirations. They bring energy and a new way of looking at the world. Additionally, they are usually capable of forming really cohesive and supportive communities once they immigrate to their new country.
So how can we help immigrants settle more comfortably into a new country, into a new life, impact their well-being, and more importantly, their mental health? Nurses can advocate for change, for support, and for resources that can specifically help immigrants settle in, which can impact their mental health positively or ultimately decrease the risks facing or acquiring mental health challenges. Immigrations face increased stressors such as economic, discrimination, acculturation due to language barriers, enculturation, parenting, and finding suitable employment, which can all lead to mental health challenges and issues. In addition to that, they face several barriers that impact them from seeking mental health services, such as stigma, lack of perceived norm in a country of origin for using mental health services, competing cultural practices, lack of information, and language barriers. When looking back on the story of Agnes, she is facing stressors in addition to fear, sorrow, which can lead to anxiety, depression, PTSD, and other mental health challenges. And she does not seek help due to the barriers such as stigma, lack of perceived norms in mental health services, and language barriers. She also experienced discrimination in her first encounter with an individual. This leads us to a very important area that we want to focus on: the stigma and discrimination that immigrants face, especially immigrants suffering from mental health issues. Stigma is a reality for many people with mental illnesses. They report that how others judge them is one of their greatest barriers to a complete and satisfying life. Stigma is dangerous because it interferes with understanding, obtaining support from friends and family, and it delays getting help. Stigma is an inhibitor of primary prevention, a fundamental cause of disease, and a factor that interferes with positive treatment outcomes. So, as nurses, what can we do? We can develop and implement strategies for reducing stigma and discrimination associated with mental health and immigrants that can be applied across various settings and various languages. Experts say that there continues to be fear and suspicion of how mental health programs among immigrants and families, and how the media plays a large role as they are frequently featuring negative images and stereotypes about recent immigrants and mental health issues, and these portrayed to contribute to public's fears about mental health conditions. Therefore, these are two very important areas that nurses can focus on. Failure to perceive the need of psychological help continues to be a major reason that immigrants do not use mental health services. Therefore, nurses must raise awareness about anti-stigma surrounding the mental health and provide sufficient education and place attention on the mental health services as an area of support and help, and not an area of discrimination or judgment. Providers need to have more interactive communications with target communities to truly understand their cultural perspectives on mental health stigma and its treatment, as stigma is a barrier that can be overcome once it is understood from a cultural, sensitive perspective.
Mental health promotion and prevention interventions for immigrants, when implemented effectively, can reduce risk factors for mental disorders, enhance protective factors for good mental and physical health, and lead to lasting positive effects on a range of social and economic outcomes for immigrants. Mental health promotion for immigrants aims to strengthen individuals, strengthen communities, by reorienting health services and promoting actions to remove structural barriers to mental health for immigrants. Actions to remove structural barriers to mental health in immigrants by promoting mental health literacy and reduction of stigma through public awareness campaigns and community-based educational training interventions, such as mass mental health literacy programs that promotes and improve public's knowledge of mental disorders and to some extent improve the public's acceptance and reduce the prejudice towards people with mental health problems. Another intervention is internet interventions are effective interventions at reducing the stigma of people and the stigma of mental health because they have the capacity to reach a wide range of people in different countries. Mental health education programs such as programs in schools and other places not only inform the children but also the family. Lastly, another intervention is mental health education programs, such as programs that you can receive at school. So not only are the children getting these educational programs for mental awareness, as well their families.
All right.
Thank you for watching our video.
Together, let's advocate to raise awareness for vulnerable populations such as immigrants who are at increased risk for mental health challenges.